Are you tired of sciatica leg pain controlling your life? The constant burning, the shooting pain, it can make even the simplest tasks feel impossible. Well, what if you could find relief without drugs or surgery? Chiropractic treatment offers a natural solution. In this video, I'll show you how targeted chiropractic adjustments can correct the misalignments in your lower spine, sacrum, pelvis, often which is the root cause of your sciatica. With over 24 years of experience, I've helped countless patients find lasting relief for sciatica leg pain. By the end of this video, you'll know exactly which adjustments can help sciatica recovery. And stick around because I'll also reveal a unique back support belt that can speed up your recovery. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical spinal decompression as the cornerstone of our unique and proven back-to-life method. Be sure to hit the subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain at home. Plus, you will discover which therapies are best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy in the link in the pinned comment below. Sciatica leg pain originates from the nerves exiting the lower back, specifically the L4, L5 regions, as well as the sacral nerves S1 to S3. These nerves come together to form a sciatic nerve, which starts in the buttocks, traveling down through the thigh, and then branches into the peripheral nerves that extend to the legs and feet. This is why a chiropractor carefully assesses the lower lumbar spine, specifically L4 and L5 vertebrae, and the sacrum for any misalignment, known as vertebral subluxations. Well, over time, these subluxations can lead to degenerative arthritis, disc disease, and lower lumbar nerves are being affected. Prolonged irritation can further contribute to disc damage and eventually disc bulges, all of which accumulate into sciatica. By correcting these misalignments in the L4, L5, and the sacrum, even the pelvis, we help restore the proper alignment of these bones, and that improves the function of the lower spine, its related and relationship to the sacrum and the irritated nerves that trigger your sciatica leg pain and can finally heal. As a result, this can lead to significant reduction and often a complete resolution of sciatica leg pain. In a moment, I'll demonstrate several chiropractic adjustments, each designed to relieve sciatica leg pain by addressing the root cause as I've just explained. Chiropractic adjustments of the spine and sacrum are safe and highly favored by patients. They not only feel good, but are effective in reducing and providing relief for chronic conditions such as sciatica. And I'll show you how these adjustments look like. So I'll now show you what these adjustments look like. The first one we're going to show you is one of my most classic adjustments. It's basically using a very special table called a drop table. So by doing alignments of the pelvis and spine, most times we're finding that the patient's alignment is changed at the pelvis. So the pelvis is the foundation of the spine. I call this like the building. If you have a good foundation, the building's on solid ground. But if it isn't, and the pelvis has shifted one way or another, we're going to be able to determine that and correct the cause at the base of the spine, which affects, of course, everything above and everything below. So the most common subluxations of the pelvis are what we find at the sacrum level. How I see that happening is by looking at the leg lengths. So as a chiropractor, we're trained specifically to check for leg length. What we always see in cases of sciatica is one leg has shifted shorter than the other. And that tells me which way to adjust and which way the sacrum has rotated. So by checking this, it's called the Deerfield leg check. I'm able to see which way her legs change by bringing her legs into what we call flexion. Bringing them up shows us that in her case, the sacrum has rotated on the right side down and in. So when the adjustments are done, we're going to always correct that at the root cause. Doing this by placing her legs in a specific manner is going to allow that joint to open up, so be preparing it for the alignment. So what I'll be doing in this case is tailbone alignment by pressing in both pelvis sides and then dropping down to restore the alignment. So you can see how gentle that would be. It doesn't hurt. These cases are very, very delicate. When we come in with sciatica pain at a 10 out of 10, I'm not going to force that into alignment in one adjustment, but we're going to restore the most gentlest way and work up from there. So the first thing we see is a leg balance occurs As we do that, the pelvis has realigned, and we're finding that can be enough to start on the first day, see how a patient responds, and they may get relief simply by doing a pelvis alignment and not forcing anything above that. Then we add in our other protocols. So in our office, the way this is determined most importantly is by taking x-rays, looking at the pelvis, looking at the alignment of the lumbar spine, taking this in consideration with our other treatments because we use a multimodal approach. So the alignment is the cause correction, and then we have accessory treatments such as decompression, laser, shockwave, that really get to the secondary effects at the disc level. We'll be getting to those in other videos. But really I wanted to show you the most simplest thing is always the most effective thing to start with, and then we can get into further alignments that I'll show on the next patient. So the next patient is going to be, let's say, someone who's advanced in care further down the road. They're showing some more improvements in the alignment, or their symptoms are reducing. So obviously as it gets more and more comfortable, we're going to increase the intensity or the amount of adjustments that I'm going to do through the spine. So the first thing we're going to look at in this case is, of course, starting at that pelvis. So here she has a pelvis that goes in that same direction. AI sacrum, which is the right side, has gone forward and in. That would mean the sciatica would most likely be on the right in this case. So by doing an adjustment on this area, we'd start with the same correction. Alignment of the pelvis here, alignment of the sacrum is going to restore the pelvis into that first cause correction. Going from there, in this case, that has leveled out. I'm going to move up the spine because she's doing better. So what we would get at is now starting to do L4, L5. The decompression has taken effect. It's causing less pressure at the disc level, and we're going to be able to do some work on this using a tool here called the Arthrostim. By gently vibrating that vertebrae, it's going to restore movement back into the spine without causing pain, without causing aggravation. And by doing this, I can use specific heads on here to target one side or the other based on the alignment that I'm seeing. There's usually a response at L5 exactly linked to sacrum because that has the ligaments that attach to the lumbar spine. So most times the sacrum correction can help assist L5 coming back into place. And if it needs extra assistance, I use tools and I use hands-on by getting in there and restoring alignment. And then thirdly, we use a tool here to reduce inflammation, break down scar tissue, and help with the adjustment, relaxing the spinal muscles. So this is called the rapid release therapy. It's a vibration tool that we can use to place on specific areas. And what this does, it just relaxes some of these ligaments, reducing the tension. The impulses are going into the tissues and helping the muscles just calm down and get flushed of that inflammatory response. So this feels very relaxing and soothing on the spine. By doing that, we're adding to the effect of the adjustment. And then in her case, I'm going to move up the spine. We're going to actually restore all areas of the spine at this point because it's all connected. A lot of these problems at the lower spine, at the sciatica, they all stem from the neck. So when we get into thoracic spine corrections, that can release a lot of pressure in the mid-back, and then checking the neck. Usually I do this with leg checks. I know her adjustments are needed on this side, so I'm going to restore C1 and then C6 on the opposite side, and this releases all the way through the spine. The final check I would do in this case is make sure legs are balanced. We know her nervous system is restored. Let it heal. Come back the next day, check for what's there, what's changed, and we keep going through our system to see this get corrected through the whole spine. Now the third adjustment, obviously you've seen this countless times. It's the typical side posture adjustment, we call this. There is a time and place for this. I usually do this gradually through care. Basically the reason is when there's a disc that's compromised causing your sciatica, there's a very delicate situation, as I said in the beginning. We're going to ramp you up through care and get you up to the point where a side posture would be safe, done properly based off your x-rays, and done in a manner that when it's time to be doing it, it's the right time and place. So as Donna's coming in for treatment, she's been showing improvements. Her pelvis is showing improvements. I know that it's stable. Her legs are actually holding even. I've seen the improvements in her lower spine. So what we'll do at this point is I'm going to do some work on the lumbar spine by doing a side posture adjustment. Facing me this way, Donna, on your side, please. So as she turns, I'm going to raise the head here so lying on your side this way and bring your hip forward. So she's getting a spine adjustment at the lumbar region because the pelvis is stabilized. We're going to move up the spine from there. So as we get her into a position, I can lock out the specific L5 in this case and get into that area by rolling her over. And then as we get in there and push that into place, it's going to release that L5 specifically at the joint. It's not a manipulation where we're thrusting into the whole spine and adjusting everything up. I want to be specific so the force is going to only where it needs to be. So that really restores that L5 as the pelvis is stabilized through this position. So if you could sit facing me that way for me, Donna. Next, I may use this tool again, but in this case, working on some of the curves in her spine. So as I work on curves, it's really restoring the shape of the spine from the neck down. So we may use this tool, the Arthrostim, in restoring neck curvature by going up and down and restoring neck alignment and curvature, working down her spine, getting into the areas where the posture needs relief, and then restoring that same idea at the lower spine, at L5. So as she arches back up, it's going to create more relief at the L5, getting that vertebrae moving again so that disc can get restored. Creating restoration of the alignment creates better fluid exchange and long-term corrections of these discs from the spinal subluxation, getting the cause corrected. Next, we're going to show you a story of a great patient who responded extremely well, starting with the chiropractic adjustments and the effects that he had from decompression and the other therapies that we do when we combine them to correct the cause and the side effects. So Russ has came in here, as he'll tell you his story, extremely in pain, extremely defeated and debilitated, and he got back to life. I want you to hear what he says, and we'll give you the hope that he has now.
My name is Russ Lucarelli. I'm 63 years old, and I found Dr. Birk while I was scrolling on Instagram. I had very bad back pain. I was at a level 15, 0 to 10 being really bad, but I was above that. I couldn't walk. I was on all fours when I found Dr. Birk. So my symptoms were a lower back pain. I couldn't bend over. It was at a point that I had nowhere else to go. I couldn't stand up straight. I couldn't walk. I couldn't sleep. To be honest with you, I was even afraid to sleep at night. Any movement, I would be like in agony. Tears would be flowing down my face. When I came into Dr. Birk, I literally was on all fours. I crawled into his office, and a couple months later now, I'm standing. I'm back at the gym slowly. The pain is almost zero. I've been under great supervision and care with Dr. Birk. So when I came to Dr. Birk, my main priority was to get on an airplane to go to the British Virgin Islands in March. At that point, I was so stressed out about not making my trip, but with his supervision, the only thing I had to do, I did postpone my trip for 4 weeks. I was able to go on April the 8th. It was fantastic, and that's all from the care of Atlantis Chiropractor.
As promised, what I was going to give you next is the back support that I recommend most. So this is the BaxMAX. We use this with every single lumbar decompression patient, sciatica patient, disc bulges, disc herniations. Because this belt is so versatile and easy to use, it has some unique factors such as having an easy to close strapping effect that you can loosen on the go. And most importantly, as part of treatment, we always recommend ice. So when you have sciatica, there's inflammation. We want to reduce that inflammation. These BaxMAX belts have ice packs that Velcro right in. So simply applied right to the belt. This is going to target the exact area at the L4, L5, the cause of the inflammation. So after treatment, after the adjustments, Donna is going to apply this with the left and right as marked. Go ahead and turn there. I'll let you grab that from the front. So she's going to close that at the front, makes it super easy to get on. And so when we have these right at the lumbar spine, the ice is already targeting that area. Next, she's going to turn this way, and we're going to pull that closed with this belt strap that really closes that in around the spine. Two effects that this has is it compresses and holds things together, and it's going to keep you upright. So as you're sitting, as you're driving, we know that the posture is causing more pressure, more compression at that L5. Sitting straight is so crucial. Sometimes patients can't do it on their own in the beginning. It's been weakened, it's hurting, it's uncomfortable, and it's a pattern. It's a habit that we're going to change by using these belts. So I highly recommend these BaxMAX belts. That's the one I use most and the only belt I recommend for all patients with sciatica. The purpose of this video was to show you how chiropractors effectively treat sciatica using specific chiropractic adjustments without resorting to drugs or surgery. Chiropractic care has helped thousands of individuals recover from sciatica and return to a normal, pain-free life. If you haven't explored chiropractic care yet, consider finding a chiropractor in your area to see how this approach can help you recover from sciatica. Now, if you found this video helpful, please like and share it. And I want to hear from you. What did you try to treat your sciatica? What methods have worked for you and what hasn't? Leave a comment below and share your experience. Don't forget to subscribe to my channel if you want more do-it-yourself tips, strategies, and exercises to help you relieve and manage your back and leg pain from the comfort of your home. And if sleeping with sciatica has been a challenge for you, I've got the perfect next video to watch. Watch this next video to learn key tips on how to sleep better with sciatica.